So, if you're applying for your first Band 5 physio job, you definitely know the feeling. You've got all this excitement about starting your career, but it's mixed with a pretty healthy dose of anxiety about the interview, right? The whole goal here is to take that anxiety and just transform it into pure, structured confidence.
And trust me, you are not alone in feeling that way. Even seasoned physiotherapists like Matt Chong, they remember that feeling all too well. Look, it's a competitive field, and the pressure is absolutely real. But a disastrous first interview, that is not a foregone conclusion.
By preparing strategically. It's not about memorizing a bunch of answers. It's about having a solid framework for every single part of the process. So, let's build that framework together, step by step. Here's our roadmap for today. We're going to cover everything, from the prep you do at home all the way to that final question you ask them. We're breaking this whole thing down into 6 manageable parts to get you from applicant to new hire.
Okay, first up, the pre-interview playbook. Because honestly, so much of your success is decided by the work you put in before you even walk through that door.
Let's start with the basics, because these are so easy to mess up. Double-check every single detail. If your interview's in person, please do a trial run to the location. You do not want that day of travel stress. And if it's virtual, test your tech. Seriously, being calm and on time is your first big win of the day.
Next, your appearance. It's your first signal of professionalism, and it really shows you value the opportunity. It might sound like a small thing, but it matters. I heard a story from one physio where the interviewer actually complimented his smart trousers right before he got the job. It's not about the expensive brands. It's all about the effort you put in.
Okay, so you've arrived. You look the part. Awesome. Now let's focus on those first few moments inside the interview room. This is where you go beyond just appearances and actually connect as a person.
And here is something absolutely crucial to remember. They want you to succeed. This quote from an interviewer at Physic confirms it. They are actively looking for reasons to hire you, for your positive points. They're not there to trip you up, okay? They're there to find the best candidate. That alone should help you relax a bit.
So walk in there with confidence, offer a firm handshake, make good eye contact, stand up straight. These are all the nonverbal cues that build that immediate rapport. And when they ask you a little icebreaker, like, how was your journey in? Just keep your answer straightforward and positive. It sets such a great tone.
Right. Once the initial hellos are out of the way, they're going to want to get to know you on a deeper level. This is your chance to move beyond your CV and really show them your character and your resilience through some structured, personal stories.
And the absolute best tool for this is the STAR framework. Seriously, anytime you hear, tell me about a time when, your brain should just immediately fire up STAR. It's what turns a potentially rambling story into a concise, powerful example of what you can do.
Let's break down how this works with a brilliant story from Matt Chong about overcoming a challenge. So, S, the situation. He injures the wrist on his dominant hand during a placement. T, the task. He has to find a way to finish the placement without any delays. A, the action. Get this. He taught himself to write with his left hand in just 6 weeks. And R, the result? He successfully finished his placement, writing all his patient notes with his non-dominant hand. Now that is a memorable story of resilience.
All right, let's get into the real core of the interview, the clinical scenarios. This part isn't just about knowing the right answer. It's about demonstrating a safe, logical, and really structured thought process.
Here's a key bit of insider info for you. Your answers are almost always scored against a checklist. So the more logical, distinct points you make, the higher your score is going to be. Listing your steps out clearly is how you max out those points. So let's take a super common scenario. A patient falls. A great answer just walks them right through the process. First, you don't try to catch them. That's a huge risk to yourself. You cushion the fall, then you perform an A to E assessment, you call for help, and you follow that entire safety and reporting protocol. Every one of those steps is a point scored.
They might also test your clinical knowledge more directly. For example, what's the difference between type 1 and type 2 respiratory failure? So you can see here, type 1 is low oxygen. Type 2 is low oxygen and high carbon dioxide. Knowing the different causes and treatments for each just shows them you can differentiate and apply your knowledge even under pressure.
You're almost there. The final hurdles are usually a practical assessment and maybe a short written test. Just think of these as your final opportunities to really shine.
A really common practical task is a joint assessment, like a knee exam. And again, what's the key? It's all about structure. Start with observation. What do you see? Then you move to range of motion. Then you test power. And then finally, you perform your special tests, making sure you name them and what they're for. This just screams thorough and systematic approach.
Then you might get a written test, like interpreting these arterial blood gas results. Now, the good news is they almost always give you the normal ranges, so you don't have to have them all memorized. You just need to know how to analyze the data they give you.
And there it is. That's the concise, clinical answer you'd provide. The low pH and the high CO2, that points to respiratory acidosis. The low O2 confirms hypoxia. And because that bicarb is normal, we know the body hasn't had time to compensate metabolically, which tells us it's an acute issue. That's the level of clear, step-by-step analysis they're looking for.
And that's pretty much it. You've done all the hard work. All that's left is to wrap up your interview with a strong, confident conclusion that leaves a lasting positive impression. So, as you prepare your final thoughts and questions for them, ask yourself this. After a long day of seeing candidate after candidate, what is the one single thing you want this panel to remember about you?
It's your confidence, the kind that's backed by solid preparation. It's your structured way of thinking, which shows you're a safe and effective clinician. And most of all, it's your passion for helping people. Go in there and show them that. You've got this. Good luck.